Being autistic does not mean you have an illness or a disease. It means your brain works in a different way from other people. Autism Spectrum Disorder, or ASD, is a neurodevelopmental condition characterized by differences in the typical development of a child's brain, thus affecting his or her social and communication skills. Children with autism often exhibit specific interests, repetitive behaviors, and sensory sensitivities. While some strengths, such as visual memory, musical, artistic, and mathematical abilities may be associated with autism, each person with ASD is unique. Children with autism may encounter difficulties in language development and understanding the meanings of words, forming friendships or fitting into social settings, adapting to changes such as trying new foods, encountering substitute teachers, or disruptions to their routine. Coping with sensory sensitivities like loud noises, bright lights, or crowded environments. Displaying repetitive behaviors such as hand flapping or engaging in repetitive speech patterns. According to the Center for Disease Control, autism is estimated to affect 1 in 54 children in the United States. The severity of these challenges varies among individuals with autism, ranging from mild to severe. Some children may require minimal assistance, while others may need significant support in learning and navigating daily activities. Autism is something people are born with, and its exact causes remain uncertain. It is believed to stem from a combination of genetic factors and other influences that alter typical brain development. Diagnosis of ASD. Parents, caregivers, or pediatricians may notice early signs of Autism Spectrum Disorder, or ASD, before a child turns 1 year old. However, these symptoms typically become more consistently apparent by the age of 2 or 3. In certain cases, the challenges related to autism may initially seem mild and only become evident once the child enters school, especially when interacting with peers. Some social communication deficits associated with autism may include reduced sharing of interests with others, difficulty understanding their own and others' emotions, avoidance of eye contact, limited use of nonverbal gestures, rigid or scripted speech, taking abstract ideas literally, and struggles in making or maintaining friendships. Similarly, restricted interests and repetitive behaviors in autism may manifest as inflexibility in behavior, intense focus on specific topics to the exclusion of others, expecting others to share their interests, difficulty with changes in routine or new experiences, sensory hypersensitivity, stereotypical movements like hand flapping or rocking, arranging objects in a particular way, among others. When concerns about a child's behavior arise, it is important for parents, caregivers, or teachers to seek a specialized evaluation by professionals such as developmental pediatricians, pediatric psychologists, child neurologists, or child and adolescent psychiatrists. This evaluation typically involves interviewing the parent or caregiver, observing the child, interacting with them in a structured manner, and possibly conducting additional tests to rule out other conditions. In some cases where the diagnosis is uncertain, the identification of autism may be deferred. However, early diagnosis is crucial as it enables access to supportive resources in the community, which can significantly improve a child's functioning. Risk factors. Current scientific understanding suggests that the risk of autism is influenced by various genetic factors, with specific conditions like Fragile X syndrome and tuberous sclerosis increasing the likelihood of an autism diagnosis. Genetic testing may be recommended following an autism diagnosis, as certain genetic conditions collectively account for over 30% of cases. Medications like valproic acid and thalidomide during pregnancy, having an older age during pregnancy, and having a sibling with autism are also associated with an elevated risk. However, vaccines, race, ethnicity, and socioeconomic status do not show a connection. Treatment. While there is no cure for autism, several effective interventions can enhance a child's functioning. Applied behavioral analysis involves a systematic study to create a structured plan for improving adaptive skills and reducing inappropriate behavior. Social skills training helps children navigate social situations. Speech and language therapy improves speech patterns and language understanding. And occupational therapy addresses adaptive skills deficits. Parent management training equips parents to respond effectively to problematic behavior, and special education services can include various accommodations. Treating co-occurring conditions such as insomnia, ADHD, intellectual disability, anxiety, and depression is crucial, involving a range of services like psychotherapy and/or medication. Medication evaluated and prescribed by a child psychiatrist may be appropriate for conditions like irritability. While various complementary and alternative interventions, including special diets and supplements, have been explored, there is currently no compelling evidence to recommend specific interventions. Ongoing research in this area continues, and parents or caregivers interested in these interventions should consult their child's treating clinician. Tips for parents: educate yourself about autism spectrum disorder. Establish and maintain consistent routines and structure. Engage with other parents of children with autism and utilize community resources. Address specific concerns by seeking professional assistance. Prioritize self-care for yourself and other family members. Caring for a child with autism impacts the entire family, often leading to stress, time constraints, and financial expenses. It's crucial to attend to the physical and emotional well-being of the entire family. Numerous national and local advocacy organizations offer information, resources, and support for individuals with autism spectrum disorder and their families. The notion that every individual with autism possesses inherent gifts may initially sound positive, but it can pose challenges for autistic individuals and their families. Some individuals with autism encounter difficulties in social situations and struggle with small talk, making it challenging to fit in and feel at ease. Social anxiety stands out as a significant hurdle for many on the spectrum. However, meaningful relationships and friendships often develop. Establishing structure and routine in daily life can prove beneficial for individuals with autism. It's crucial to recognize that autism is not something one can outgrow. However, symptoms may evolve or diminish at different life stages. Autism manifests uniquely in each person, resulting in diverse experiences. We all have individual skills, attributes, and characteristics that are as unique as our personalities, and this is the power of neurodiversity. We hope this video has helped you understand autism spectrum disorder. Like and subscribe to our channel for more content on health and wellness. Thank you for watching.